I want to welcome you here on behalf of the Chamber. I'd like to take a moment of personal privilege and recognize the Chamber staff, if you would stand and be recognized. And also, we have several members of our Board of Directors, if you would stand and be recognized. Thank you very much. Here in the Tampa Bay area, we're proud of our strong healthcare system and thriving business community, but both depend on one thing: people having access to affordable, reliable health coverage. And that's why today's conversation is so critically important. We're talking about enhanced premium tax credits, or EPTCs, which are healthcare tax credits that have lowered insurance premiums, helping millions afford healthcare coverage through the individual marketplace since 2021. But unless Congress acts, these tax credits are set to expire at the end of this year, triggering widespread coverage loss and higher costs for families, businesses, and healthcare providers. Before we begin, I want to take a moment and we're going to watch a short video about the tax credits, which will help lay the foundation for our conversation today. Let's see the video.
Millions of Americans rely on enhanced premium tax credits to afford health coverage. In 2024, these tax credits helped 24 million people get coverage, keeping healthcare accessible for working families, small businesses, and more. But these tax credits will expire in 2025 unless Congress acts. If they're allowed to expire, millions of Americans will face a tough choice: pay much higher premiums or go uninsured. Without coverage, many will delay care until emergencies, leading to overcrowded ERs and higher costs for everyone. The economic impact will be severe. But we can stop this crisis. Congress must act now. Tell Congress to extend the enhanced premium tax credits.
We're incredibly blessed this morning to have an incredible panel with us this morning, and I'd like to introduce them now. Mr. Brent Burish is CEO of HCA Florida St. Pete and Pasadena Hospitals. Tristan Brown is the Advocacy Manager at the Foundation for a Healthy St. Petersburg. Dr. Krishna Tiwari is the President and Founder of the Inpatient Specialist Group. And Mr. Mark Wilson is President and CEO of the Florida Chamber of Commerce. Thank you, Mark, for being here. We really appreciate it. This first question is for each of you, so we'll just go right down the line. To start, the enhanced premium tax credits have helped over 4 million Floridians access health coverage, including more than 400,000 right here in Tampa Bay. From where you sit, why is access to health care such a critical issue right now? And Mark, if you'd like to start.
Yeah, I'd be happy to. Good morning, and thanks for having me. Florida is an important state, and this is an incredibly important issue. Let me just quickly answer it this way. There are a lot of issues in the world right now, and I just want to acknowledge there's a lot of uncertainty in the world right now, and what we need is certainty on this issue. And I run the Florida Chamber of Commerce, and what you would expect is I care about people, and I care about growing our economy. And we have 23 million people who are here right now, who are residents. We're going to add a lot more, but we need to create 1.3 million new jobs in Florida by 2030. And let me just make it real. Over the last year, Florida has added 150,000 new jobs. We're number one in the country for new business startups. But if Congress doesn't fix this issue, it's 50,000 jobs that are going to be lost in Florida. So you could wipe out 1/3 of all of the job gains that we've had over the last year. And that doesn't even begin to get into the impact of how this impacts families and who already are deciding between whether they can pay their rent or whether they can pay their child care or whether they're paying their food. So if we want to be the state where it's the best place for education and the best place to work and the best place for quality of life, Florida is impacted more negatively than almost any other state. And so this matters to the business community, it matters to the people of Florida, and I look forward to talking more about it on the panel today, but that in a nutshell is why it matters.
Thank you.
So the Foundation for a Healthy St. Petersburg is a private foundation, but we're also an evidence-based organization, and we have a deep belief that when people are healthy, all of our communities can thrive. And so as we're currently seeing, healthcare costs are continuing to rise while people's wages are having a hard time keeping up with that. From our organizational perspective, we have a mission to achieve health equity for all people regardless of their race, ethnicity, geography, and income, with a particular focus on Pinellas County and South St. Petersburg. And so I also look forward to getting more into just the specifics about the data and the research that we're seeing, but just generally, we are obviously not anywhere close to fulfilling that mission, and I think more importantly for the people of South St. Pete and Pinellas County and the state of Florida, this is an issue that will remain crucial and critical, and that we'll continue to see have long-lasting impacts even well beyond the healthcare sector and industry, and that I think is why it's really critical for us to address that now more than ever.
As a physician, every single day, I personally see patients in a hospital setting, and I witness this every single day. People who have insurance, who don't have insurance, or what we say sometimes underinsured. And with that, every day I see those barriers in healthcare, in even social statuses, in trying to get the patients or the people who are in a hospital setting who don't have access, and it being a barrier to us effectively managing and treating patients so that we know they could get the standard of care that they deserve. So this is extremely important because every day, all day long, even night, literally we're witnessing this as physicians, and to get that message out there of what it means to have patients who don't have the access because of no insurance or the inability to afford it, is a big issue because it causes a lot of utilization, a lot of downstream effects problems that I'm sure we'll get into. But for me, seeing this every day and being able to tell that story to people, I think is a big eye-opener to see what we have to deal with just to cross the red tape, and ourselves personally even experience that from the side of hoping to get the type of care, medications, even ability when they get discharged from the hospital to home, what their needs are, and them not having the insurance be able to cover it as well. So looking forward to discussing that.
Representing hospitals, certainly health insurance is a healthcare and a hospital issue. This is also a business issue. I think the first reason we're here today is to raise awareness. Without action by Congress, these enhanced premium tax credits will expire at the end of this year. 4.1 million Floridians, over 1 million people more than any other state in the United States, will see their premiums go up by, on average, almost 100% for the same health insurance coverage they have today. That will lead to people deciding if they keep health insurance, and if so, what does that do to the rest of their budget, whether it's vacations, whether it's other entertainment, whether it's other aspects of their life, or do they give up coverage, which affects preventative care, leads people to give up primary care coverage, come to hospital emergency rooms more. So primary reason we're here today is to start with awareness, and then we'll talk about action. But this is not just a healthcare issue, this is a business issue.
Thank you. And to kind of build on that, as a hospital CEO, these gaps translate into real financial pressure for individuals, but can you talk about what the expiration of these tax credits would mean for operations and your ability to invest in your staff and operations and facilities?
Part of a hospital's requirement, as it should be, is to treat everybody that walks in our emergency room regardless of their insurance coverage and their availability to afford care. We are really the only healthcare setting where that is true. So a physician's office can require payment. Urgent care settings, which HCA has grown into with 4 MD Now urgent cares that have opened in the county within the last 3 years, is another setting of affordable care. But without healthcare coverage, we see emergency rooms be utilized more. It's an expensive setting of care, but it also affects availability of care from a timeliness perspective and ability for care. If you look at Pinellas County, less than half of the hospitals in the county today deliver babies. The majority of those covered have either Medicaid or enhanced premium tax credit or some type of commercial insurance that deliver babies. So if you look at specific service lines, there's impact. But ultimately, part of the impact is people delaying care. The enhanced premium tax credits passed and came out partly during the COVID pandemic and the start of that to make sure people had healthcare coverage during one of the biggest healthcare crises our nation has faced in recent memory. That has continued to today. And so without this coverage, we risk people not being able to have mammograms, have screening colonoscopies, delaying care where by the time they come to a healthcare setting, whether that's the hospital, whether it's eventually getting healthcare insurance and going to their physician, they're further along in care that could have been earlier treated and prevented, which is one of the biggest risks of losing coverage.
Thank you. Mark, from the Chamber's perspective, these healthcare tax credits are helping hundreds of thousands of small business owners and self-employed workers afford coverage. What do you think is at stake for Florida's economy and business climate if these tax credits expire?
Yeah, so it's a little bit about what I said earlier, right? So Florida is #1 in the country for new business startups. So think about that, right? More people start businesses in Florida than any other state in the country, more than Texas, more than California. What's one of the biggest reasons you wouldn't start a company? Is you can't figure out what to do about health care, what to do about health insurance. And so when this came along, what the federal government said is we want people to work, we want people to be involved in starting new companies, and this has actually been a springboard for that to happen. And so, as I mentioned, the data says that we'll lose 50,000 jobs in Florida if this doesn't happen. I think what's also going to happen, and it's very clear, is I think a lot of those people who took the leap to start their own company would say, wait, if I can't have access to affordable health care, then I cannot go out on my own. I'm going to have to find something out. So we're not going to be #1 in the country with new business startups if we don't figure out a way to fix this. What we've been doing is we've been incentivizing and encouraging innovation and encouraging new business startup, and it's been working. That's why we're #1 in the country. So I think that it's really important to understand that there's clear negative impacts on people of Florida. The other thing I would add real quick, Charlie, is I don't know if you all are familiar with something called ALICE, but it stands for Asset Limited Income Constrained, and it's a United Way platform that we subscribe to. I think everybody up here knows what it is. Here's what it means. 47% of people in Florida today who work and rent are in what we call the ALICE population, 47%. And what it means is they have to make choices every month between paying the rent, the electricity, the food, the health care, et cetera, right? Already 47% of Floridians are making that choice. And let me just tell you, we just came out with a study. 270,000 parents in Florida who work with kids under 6 just quit work because they couldn't afford or find quality child care. 270,000 people in the last year in Florida left work because of it. What do you think's going to happen when their health care premiums nearly double? Right? They're going to go without. And when they go without, or they go without something, something's got to give. And that's not good for people, that's not good for our economy, and it's why Congress just simply has to do this.
No, I think a lot of people think of this as an individual person or family issue, but we appreciate you hitting highlight of not only impact small business today, but the creation and potential for new businesses tomorrow. Tristan, your organization focuses on health equity for residents in our community. As more folks are not getting their coverage through a traditional employer, especially small business owners, self-employed, part-time workers, how important do you think it is that there's a reliable, affordable coverage option like the Marketplace?
Well, Charlie, I think it's extremely important. It just seems like very basic math, but as everybody here probably already knows, when we have lower cost, we have more people signing up for healthcare insurance, and the reverse is true. When we have higher costs, we have less people signing up for healthcare insurance. And so that's especially true and important for those self-employed individuals, small businesses, gig workers, freelancers, and folks of that nature. But like I stated earlier, it's not something that is only specific to the healthcare access issue. It's something that does have ripple effects. We see the public health consequences of it. We see the economic impact. On the economic impact front, as Mark just stated, we will probably see reduced entrepreneurship rates. We'll probably see lower workforce productivity. If folks are in poor health, they have a less likelihood or probability of being able to work a job or hold multiple jobs. We'll see a decline in local consumer economic spending. If you are tapped out because you're spending a lot of your money on medical expenses and bills, then you probably don't have as much money to spend on things like housing, education, and just local businesses. On the public health front, we see if our ERs are overburdened, then we have more expensive but less efficient care. If we have undetected outbreaks or untreated mental health issues, that creates broader implications for our community health and the risks that are associated with that. And so the list just goes on. And so I think that, the issue itself, but also the overlapping consequences that just kind of come as a result of that issue of just an inability to access affordable health care is just a number of reasons why this is a really, really important topic.
Do you see that ripple effect of the lack of care, the initial visit, as Brent mentioned, especially in our communities of need?
For sure. And I'll talk more. I know we'll get into just kind of those neighborhoods and demographics, but we've done a lot of research on the South St. Petersburg area specifically, and just seeing how those ripple effects also lead to ultimate negative outcomes like lower life expectancies or just higher preventable deaths. And so it's an issue that I think we can talk about it in numbers, and sometimes it makes it feel like those statistics are just kind of abstract, but I think it's important to really underscore that these are data points and statistics that are reflecting real people, real struggles, real issues, and I think it's more important to underscore that these are issues that we don't have to see. They're very preventable, and I think we're here today to talk about the expanded premium tax credits, which has been a really huge initiative to maximize those opportunities to make that access to healthcare more affordable and accessible.
Thank you. Doctor, you've got a unique perspective on the issue as both a clinician and a business owner. You see firsthand what happens when people delay care and how a manageable condition can become very serious. And you also see the challenges facing employers. Talk a little bit about both your perspectives about the clinical and financial consequences when people don't have this access to coverage.
Absolutely. So it's a true story with the ERs. It's overloaded. It affects staffing. It affects, the bottom line. It affects the doctors. It affects the nurses. It affects the phlebotomists, the radiology techs. Everything when people come and utilize a hospital setting because they don't have insurance and there's no other resource for them to go. Today we are seeing younger people that as healthy as they can look like coming in with heart attacks, strokes, and other new diagnoses of cancer, brain tumors, everything else. That's not even to discuss that 90% of health insurance is utilized towards the end of life or towards advanced age. So we're dealing now with a much broader spectrum of sick people coming in that have not or could have had some form of preventive care. As a physician, we're seeing that every day. As a business owner, I have about 40 or 50 physicians and 20 other APP providers under our umbrella, and it affects staffing in a significant way because for us to be able to staff appropriately so that we can take care, manage patients adequately, when you have a surplus of people utilizing the hospital system, that requires more staffing. And if you have insurance companies that we're battling with every single day, refusing to pay reimbursement to physicians or providers, it takes a financial task and toll on a business as well. So from a business standpoint, for us to provide that adequate level of care that everyone deserves, as a system, we all have to staff appropriately, and we have to have the right people on board. And from what we're seeing every single day from a physician standpoint, it's just getting worse. Every single day, we even amongst my own colleagues, we say, we can't believe that we just saw a 30-year-old come in with a heart attack that went in as a STEMI alert and now is in a cath lab having 3 or 4 stents put in. We did not see that years before. We're seeing people coming in with strokes that have now lost their complete right side, not able to talk, may not have insurance or the appropriate type of insurance that they would need to recover at a rehab facility, requiring the type of home assistance or needs that would require them to move around appropriately, get that personal care that's needed to make sure that they're not aspirating, 24/7. So there's a lot of other things at play here, just that once that patient comes in or that person comes into the emergency room through the course of stay, there's a lot of moving pieces that I think people don't realize. So for us, from a healthcare standpoint, a business standpoint in healthcare, we want to be able to provide that appropriate level of staffing for managing younger people coming in sick, people at middle and advanced age that may have not had that care that are coming in more and more sick, requiring dialysis because You know, they were not able to get their labs or afford their blood pressure medications. So for many years, they had uncontrolled blood pressure, and now they're in end-stage renal failure. And that is a very costly diagnosis, because that requires not just requiring hemodialysis, it requires transportation, right, 3 days a week. So other factors are involved, and from the business standpoint, it's hard for us to say on a daily basis the manpower that we are fighting with insurance companies to assure that patients under our service are getting the adequate care and level of social needs and requirements that fulfill our satisfaction as a provider, that they're going to be safe once they're discharged.
Thank you. As you can see, that's obviously the tragic potential consequences for the individual, but it has a ripple effect across a much broader scope. And Mark, I want to talk a little bit more about, we started talking a little bit about it. Florida has an incredible business reputation. Can you talk about how, looking down the road, this ripple effect on our open for business mindset that we talk about all the time for Florida?
Yeah, I will, Charlie, but I think it's also important to connect something back to what Brett talked about, which is awareness. So I mean, this is what I do for a living. I could talk all day about the importance of this to the future of our economy in Florida. And as I said, you know, we need to create 1.3 million new jobs in Florida by 2030. And we should be doing everything we can to get behind that. And if we don't fix this by the end of the year, we literally, I'm a pilot, so I talk in terms of headwinds and tailwinds. We literally just purposely put a headwind in front of where we're trying to go as a state. And that's bad for people, and it's bad for local businesses everywhere. So Charlie, there's really no way to sugarcoat. If Congress doesn't do this, it's going to be bad for the health of people, and it's going to be bad for the local economies around Florida. And as a consequence, we're going to have fewer people starting companies and more people who are trying to make their startup work say, I can't do this anymore. And no one wins when that happens. I also want to comment, you mentioned insurance companies. And I think, you know, think about what I do on a daily basis. I talk to members in the legislature. I talk to members in Congress. I talk to every kind of company you can imagine. And the insurance companies want this to happen too, right? Because we're all aligned. We want people to have care. We want people to have insurance coverage. And everyone loses, literally everyone loses if this doesn't move forward. Having people, to your point, having people without coverage at all present in the emergency room is the worst possible scenario for the people that are presenting and the worst possible scenario for all of us. So this is a clarion call to me. I want to talk more about awareness when we have time. But I think we really need to up our efforts on awareness, especially after the July 4 holiday and they get this other bill out of the way. This needs to be the big one.
Absolutely. That's why we're here today, and that's why we're so glad that we have you in the audience with us. Brent, if you talk a little bit about the impacts on this down the road, when you're talking about your ability to attract and invest in your staff and your talent, and also if you have all that uncompensated care, your ability to invest in activities in the community as well.
The majority of our medical staff, which is over 400 providers total, are private business owners, Dr. Tawari being one of them. This affects them both in their personal employment as business owners of their team members, as well as their ability to have appropriate compensation to care for individuals, or those individuals even seeking them out electively if they have health insurance. So when you talk about retaining, attracting the best talent to Florida in the healthcare industry, this becomes more of a challenge from a business perspective. It becomes a major community issue that may not be seen day one, but does affect us over time. And we've seen the positive impact over the last 5 years of what legislation has passed. And I'll take a minute to bring it back home to this community. We've talked to the state nationwide impact as well, and this is a federal issue. In the congressional district that we sit in right now, it's 93,000 people that are covered by the Affordable Care Act or Marketplace Insurance. 93,000 people that, on average, will see their health insurance premium go up almost 100% starting in January without action. That's just the district that we're in immediately. I had the opportunity earlier this month to go to Washington, D.C., see both of our Florida U.S. senators, 4 of our congressmen and congresswomen, and while they are aware of this issue, one office directly told us, I've only heard from hospitals about this. I haven't heard from any of my other constituents. This isn't top of mind for me. And yes, there's a lot going on in the world. I fully respect that. They know what the impact could be. There is not a landing place for people without the marketplace insurance. So if the marketplace insurance becomes unaffordable, most of those individuals don't have another option without seeking different employment or a different lifestyle that would affect them. Yet our representatives are saying they're not hearing that from those that they represent. So as the biggest impact as a hospital, it does affect us in our ability to attract and retain talent. It certainly affects our ability to care for patients in the proper setting, but it's going to be an effect that continues to build over time without something changing so that people have health insurance.
Thank you. Tristan, I want to go back a little bit and talk, if you talk specifically about neighborhoods in our community or specific populations that are going to most be severely impacted by the expiration of these credits.
Yeah, sure. So I mentioned at the end of last year, we published an equity study specific to South St. Petersburg. And through focus groups and data walks, we found just kind of the through line for a lot of the residents there in terms of priorities and issues. Number one that kept coming up was just difficulty affording healthcare, but also a desire to access affordable health care. And so for us in that area, this is an issue that already exists. And I think when we relate it back to the EPTCs and the expiration of them, if that is what happens, it's gonna be an issue that is just dramatically exacerbated. I mentioned the lower life expectancy. So the average life expectancy throughout Pinellas County is, I believe, 78.7 years of age, but in South St. Petersburg, that average life expectancy is about 73.3 years, which is about 5.5 years. That's not nothing. When we think about just the preventable deaths from chronic diseases, there's the comparison in South St. Petersburg, we have about 40 deaths per 100,000 when it comes to diabetes-related deaths, compared to about 5 deaths per 100,000 across the county. And so it has very real impacts, as I've stated a bunch already, for folks in South St. Petersburg. I also want to just underscore the impact that this can have on our older enrollees who are aged from about 55 to 64 years old. With EPTCs, the costs there have been capped at about 8.5%, which has allowed older enrollees to retire early without losing their health care coverage. And it's also allowed them to not have to worry about going bankrupt because they're spending all of their money on trying to access affordable health care coverage. And so if we don't have this, this creates a huge issue specifically for that demographic. And so those are just a couple of populations that I really wanted to highlight. And if folks are interested in looking more at our equity study or just kind of finding more about those stats, I will be hanging around a little bit afterwards and would be happy to talk more about that too.
Thank you. Doctor, we've talked a little bit about specific outcomes for individual patients that delay care, but can you talk a little bit more in depth about what you see as the impact on our local Tampa Bay health economy and healthcare system?
Absolutely. So every day when we come to work and we see, you know, my type of field, we're a hospitalist, meaning that we take care of patients exclusively in the hospital setting or like in post-acute type settings as well, which are like rehab centers or subacute hospitals. And so our job is to see sick people. That's, you know, if they're coming into the hospital and there's a reason for them to be there, you know, we are the physicians that care for that, those people. And what we see from the moment the patient enters the emergency room to discharge is a wild array of things. And I get different types of patients who have had insurance and they've taken care of themselves, but they have chronic conditions and there's nothing they can do. It's genetics or other factors that may play roles as to leading to these chronic conditions. Most of the time, and a lot of times, we see people who come in and they're preventable type diagnoses that if they were monitored or at least addressed over a period of time, they may not have come in the situation that they came in. And when they do, they come in very sick. And they are sick enough to be in ICU type setting or a critical care type setting that at that point, it's a turning factor in people's lives because it could lead towards a situation of full recovery or not full recovery that impacts not just themselves but also their families as well. And that cost and that emotional and that physical stress that it puts just not on the patient, but it puts on their own family members, it puts on even from the staffing standpoint, when we see this and we deal with that, it's hard for us to see someone come in that could have been preventable. And, again, I say we talk amongst ourselves. It's, only if, and what we say is only if they were seeing someone in the last year or got blood work or their blood pressure was a little bit better adjusted or their diabetes, whatever it may be, that would have been even preventive medicine, even if it would have been, if we talked a little bit about diet earlier on some side conversations, if, they may have had a better diet control or lifestyle modification, as we say it, alcohol and smoking are all contributing factors too. But we see those at the worst of their impact, at their peak of their situation, is what we see. And that is probably the most difficult time because the impact that it has, not just from a physician standpoint, but what we see from a population standpoint. Because in the end, whether we're people who are against this or not, every human being health is going to be an issue at some point in their life. And it's amazing to hear some stories of patients that come in and, whatever political arena they may come from, let's say they were probably not pro-health most of their life, but they leave the hospital becoming pro-life. Now they understand insurances, now they understand the barriers, and they understand the impact that if something was done, not just from a personal standpoint, but from a government assistance or a community assistance, educational or awareness, that their loved one or themselves may not have been in that position. And that's probably one of the most saddest things to see, is because it takes, at some point, a reality check of themselves or their loved ones for them to realize what situation they're in.
Thank you. Before my next question, we're going to have a couple minutes for questions from the audience, so if you're thinking about a question, start formulating that in your head now. Now we're going to do a couple of quick lightning round questions, real quick answers from you. We'll just start with Mark and work our way down. If you had 30 seconds with a member of Congress, what's the one thing about the enhanced premium tax credits that you would share with them?
So funny enough, I've had more than 30 seconds with a lot of members of Congress on this very issue, and I want to double down on what Brent said. Most of them are focused not on this, and it's way at the end. They have until the end of the year. And think about what we do in our country. We never do things early. We always wait till the last second. It's what Congress does. So Winston Churchill has a quote, and it says, "You can always count on America to do the right thing, comma, after they've tried everything else first." And so we need to, I don't think there's a massive group out there trying to not make this happen. We haven't started a groundswell yet over the summer and fall to say, get ahead of this has to happen. So I think raising awareness would be, if I had 30 seconds with our entire delegation, it would be, look, you got to get familiar with this. Tell me let me talk to your chief of staff. Let me get you the information, because you've got constituents that this is going to hurt in a big way. It's going to hurt local business. It's going to hurt seniors. It's going to hurt everybody in between. And Florida gets hurt more than any other state. And so we got to lead the effort nationally to get it done.
So I would first preface the conversation with telling them we are a private foundation. We are not here to give any calls to action because we don't want to violate our status, but we are here to share information. And I think the top 3 points would be, as it relates to EPTCs, they make insurance more affordable, they keep more people covered, and they keep the insurance pool healthier overall. And I think it might be useful to add that it's just better to be on the offense than the defense. I think the raising awareness point is extremely important, and also it shouldn't have to necessarily take people calling your phone to get ahead of an issue. And so this is an issue, whether it's dealt with now or later, that constituents will at some point be calling your phone about. And so just knowing the information that we know about it and the facts that we have surrounding it, it makes sense to probably just start thinking about it now versus later.
So as a business owner and as a physician, I have a choice what I can do. I choose to not just be administration, I choose to be a physician, only so that I can go to my physicians and say, I see what you see every day. That's exactly what, as a congressperson, I feel they should be hearing from people, because the only way someone can make a decision that impacts people is from real life stories of what we're seeing on the ground. And to me, that's the way I run my business. That's the way I treat with my physicians. We're the same, and if they're experiencing it, the plus, the minus, that's the feedback that I see in real life, and that's what I would give to the people that have a say.
My first message is that marketplace insurance is being used by their constituents. In the last 5 years at our hospitals, the amount of patients or people coming in with marketplace insurance has more than doubled. This is a pro-healthcare issue in having insurance coverage. It's also a pro-business issue. People get the choice of what type of coverage they want. They have affordability, and they're choosing this. So without action, they're not only impacting the health of their community, they're impacting the business in their community as well.
All right, Brent, we'll go back the other way. If you could sum up the stakes of this issue in a headline, what would that headline read?
Coverage in crisis. It is that significant for our community. For those individuals 25 up to 65, if you're a small business, if you're an entrepreneur, this is your #1 avenue to have health insurance. And to drive it home, Keep Americans Covered is a nationwide organization that's championing some of the voice around this. They have a website. Anyone who's covered of the 26 million Americans can put in their information, find out how much higher their health insurance will be for the same plan next year. A married couple who are 60 years old, making $80,000 per year. Maybe they're entrepreneurs, maybe they work in a small business. Their health insurance premium for the same coverage today could potentially go up by over $16,000 next year. They're going to have to make a choice of whether they keep their health insurance or some significant life decisions without that income. So it is that significant to say coverage in crisis.
I would have warning and red flags as my headline, because if we are still in crisis today and we make decisions that's going to impact more negative, I can only imagine how much more it's going to get worse, not just for everyone, but for financial impacts, community impacts, and really just the overall prospect of our future generations, because what we do today affects 10, 20 years down the road. And the decisions that we make today, if we're thinking in the moment and we're not thinking for what we are doing to protect our future, then I can tell you right now, where we are today, even with what we have, is not good enough. So we are still striving for something that is not perfect, but we need to get better than where we are.
Thank you. No, you're good. I would probably say something along the lines of expiration of EPTCs leads to sicker society, because I think just based on this conversation that we've had, the thing that continues to just be highlighted for me is this something that will touch all facets of our society and also just everybody. You talked about the younger folks who are coming in their early 30s suffering from issues that we are not used to seeing young people suffer from. You know, I mentioned how older enrollees will be impacted. When we think about just the quality of access to care, if you are low income or someone belonging to a minority group, the data just shows that you are often receiving worse care. And so it's like, if we are taking away this one opportunity where we are able to create some positive impact on the affordability issue, if we are just kind of eliminating that, then we're going to see ultimately, whether it's instantly and over time, just our society collectively becoming sicker.
My vote would be, I think if you look at what's going to happen between now and then, I think Congress will probably pass the permanent extension of the Trump tax cuts. And so I would play off the permanency. I would play off the momentum of the permanency. And I would say Florida's delegation leads the permanent exemption of this premium tax credit. So I mean, let's go on offense and say, hey, since we're making things permanent, let's make this permanent while we're at it.
Is there someone from the audience that has a question? Yes, sir.
I can start. Again, I think it starts with making sure your legislatures hear from you. How this affects you, how that affects your business, how that affects your community. As I've shared, we have had elected officials either not aware of this issue at all or saying they're not hearing from their constituents. at your tables, and I'm sure there's other information through Keep Americans Beautiful, Keep Americans Covered, excuse me. One and the same, maybe. There's also advocacy, whether that's letters to the editor, whether it's op-eds, whether we host town hall forums with elected officials, but how do we make sure they have a voice? I think one thing I want to clarify is while the current enhanced premium tax credits are set to expire at the end of the year, really Congress needs to take action between now and the end of September. Insurance rates get set in October, marketplace sign-up happens in November. So without action between now and then, the sticker shock of that added price is going to show up in November, even if there's action taken afterwards.
I would just also underscore like the power in doing that advocacy amongst your friends, your colleagues, and just people that you know in your families. Connecting it back to Brent saying that a lot of lawmakers are just saying, well, we know what the impact is going to be, but we just don't have constituents calling. I would venture to say it's not because those constituents don't care, it's because they probably just don't even know what they're about to be in for until they check their premiums when they renew and see that it's been raised almost 100%. So even just doing some of that advocacy in a way that's also accessible and digestible in terms of language, because I think insurance and just issues around it can be so complex that that is almost what turns people away from wanting to get that information. But just sharing it in a really easy to understand way so folks have that information and can also feel empowered to support us in doing some of that advocacy with the stakeholders who have that influence.
Real quick, I love the question. I agree with everything that's been said, and I think with Brent's timing on this, you think about it, we really only have about 60 days, 90 days max to really get the pressure up. Here's what I would ask everybody in here to think through. If you run a business, right, don't you want to know what your customers are talking to your employees about? Don't you want to know what your customers like and don't like? Members of Congress are the exact same way. They're talking to their staff all the time about what emails are we getting, what phone calls are we getting, who wants to visit us and about what. We can talk about this, but call your member of Congress every week. Call their district office, call their DC office, and recruit 100 other people to do the same and ask them to recruit 100 other people. The goal ought to be that this is the #1 issue that your congressional delegation is getting calls and emails on by the time end of July rolls around. And so I think talking about it's one thing, but getting an army of people to make the phone calls, send the emails in, be super respectful. I mean, this is an issue that has to get done. But I'm telling you, I have 35 lobbyists at the Florida Chamber. And the number of times I go in to meet a member of the Florida legislature who says, no one's calling me about this. I'm not hearing about this from back home. You can call us, you can call Charlie, but if you're not calling your member of your delegation, then it kind of doesn't count.
Other questions? Yes, sir.
You four have been very informative, and I thank you for that. My question would be, I hear it sounds like a lot of lack of awareness, but is there also a growing opposition to this tax code expiring, who support it expiring? Because I'm not sure which has been an issue.
Yeah, I chaired our National Association of State Chambers. I've checked with other states around the country. I'm not aware of a massive effort to say no. I think the problem we have is just a complete and total lack of awareness. And so all the millions and millions of people that are going to be impacted directly, we need them to take action too, because they certainly don't want it to go away. So I think our challenge is there's just a lack of awareness on the, hey, this needs to be extended side of the equation. Maybe somebody else knows more than me. I have heard in my calls to our congressional delegation in Florida, anytime you talk about health care, everybody's got an opinion of how to improve it. And so there's constantly a discussion about, well, if we're going to open this discussion, can we also do some other things? There's litigation reform and medical malpractice reform. There's a lot of other things that could be done, but that also could muddy the water. But I'm not aware of a significant groundswell across the country saying, let's have more people uninsured and let's have more people pay twice the premiums. I mean, are anybody up here?
No, I agree. Recently, I was in one of our city mayor's offices having a conversation in part about this issue. They knew nothing about it, and it will affect public health. It will affect their city, in addition to obviously the state and the nation. So I think awareness is the primary issue. And you're looking at an expense or tax credit that's already in place today. So it's extending what exists today, not starting something new.
And across the country, they don't see it, the impact as great as we see it in Florida, specifically in Tampa Bay. Can you, maybe we have maybe time for a little bit, one more question, and this deals with the awareness and how we communicate with our legislators. Is there a misconception of the marketplace and these tax credits out there, and how do we fix that if there is?
I wouldn't say that there's necessarily a misconception. I feel like we keep going back to the awareness thing, but I think a lot of folks who may even benefit from expanded premium tax credits, they may not even know that they benefit from expanded premium tax credits. And so I think just in terms of advocacy and our just kind of call as advocates and individuals is just making it more accessible. I feel like I'm gonna keep saying that because when the language is just not easy to understand, the natural inclination is like, okay, this is something that probably doesn't impact me, or I'll deal with it when it does impact me. And so even if it's like encouraging or asking your friends or colleagues or employees or whatever, do you know whether you benefit from enhanced premium tax credits? Like, that could be a question that feels silly to ask, but it may encourage people to like check and do the digging. And if they feel like, oh wow, now I have a direct kind of stake in this fight, then there's just kind of a little more investment. So I wouldn't necessarily, and I could be wrong, I wouldn't classify it as a misconception, but just something that's so kind of high level that I think it's our job as advocates to kind of bring it down to folks' level where they feel like, I need to just double check, I need to feel more invested, and that way I can feel like there's more engagement opportunities for me.
Anyone else?
I think when you look at this issue, roughly 11% of our patients that come to our hospitals today have marketplace insurance. So it may be simply, well, how important is this issue if it's a small proportion of our society? I think you've heard very clearly the impact on business and on future business growth, for the impact on health. I wonder, in our region here, what is the impact on tourism from people who come to visit Florida that now have a higher premium on their health insurance and may not have discretionary income? So I think it starts affecting virtually every phase of the business society and health for a number of people. Again, talking about 93,000 people just in the district that we sit in right now. So to us, it's a big enough issue, but I think you're talking misperception. Is it a big enough issue? And clearly, I think today the answer is yes.
Thank you. If we could give a round of applause for our incredible panel this morning. This morning we have heard how the tax credits are not just numbers on a page, they are access to care, affordability, workforce stability, and opportunity. The conversation cannot end here this morning. It needs to continue through our community. Whether you're a healthcare leader, small business owner, or simply someone who cares about our community, your voice matters in this fight to protect these critical supports. If you'd like to send a letter to Congress about this issue, there's cards on your table. You can scan that QR code and you'll be directed to a page that's preloaded with a sample email to your member of Congress. All you have to do is add your name and address and information. You can also scan there to join the Good Government Group Ambassadors Program, which is supported by Brent's Hospitals and HCA Healthcare, if you'd like to find out, and if you'd like to find out how else you can advocate for the extensions of the tax credits. Again, we thank you for joining us for this incredibly important conversation and encourage you to go out and share this with your neighbors, friends, coworkers, and your members of Congress. Thanks for being here. Have a wonderful day.